Now starting, all attendees are in listen-only mode.
Hi, good morning. Today is Wednesday, January 27th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Self-Directed Person-Centered Plan Process Rates and COLA for coordinators of community services and providers. Our presenters for today include Dr. Yamanja Smalls, Coordination of Community Services Director. We have the regional directors, Nick Burton from Central Region. We have Kathy Marshall from Western Region. We have Kim Gescheidel from Eastern, Onesta Duke from Southern, and also we have the deputy at Western, who is Linda Yale. We also have self-directed leads. Ola Atuyalo is the self-directed lead in Central, Tia Henry in Southern, Tina Swink in Western, and Jonna Hitch in Eastern. We also have Mary Ann Kane-Bresci, Director of Family Supports. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. And if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. There's a handout for this webinar, and you can find it in the handout section to the right. They can also be emailed upon request. We are recording the webinar, and we'll post it on the YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Nick Burton.
Good morning. Welcome to today's webinar, which is focused on self-directed person-centered planning. This webinar contains many of the components of our November 6th PCP webinar. However, today we will solely focus on individuals who are self-directing their services. As Deputy Secretary Simon has said, the DDA is committed to the success and growth of the SDS model. The SDS service model is an active reflection of the DDA's person-centered planning values and process that ensures each person is in the driver's seat as they plan for their good life. During this training and after, the DDA will continue to ensure you, our CCS partners, have what you need to successfully facilitate robust PCPs with each individual you support. The regions stand by, ready to collaborate and continue to move forward hand in hand with our transformation goals, ensuring a more person-driven system. Next slide. This is our agenda for today. We certainly just had the introduction of what this PowerPoint is going to be reviewing and this webinar is going to be reviewing. We're also going to do an overview of the self-direction services, pre-planning process, the development process, the approval process, the authorization process, and of course, questions. And again, please remember this is specific to self-directed person-centered planning. Next slide.
Good morning, everyone.
Marianne.
I'm sorry, Nick. Good morning, everyone. As Nick stated in his welcoming remarks, the DDA is committed to supporting the person and their family in the self-directing of their services. We want to reinforce, again, that the person is in the driver's seat in the development of their vision and the trajectory of their life. And to that end, we believe that everyone has the right to live, love, work, play, and pursue their aspirations in their community. We know that people lead whole lives made up of specific, connected, and integrated life domains that are essential to a good quality of life, which include relationships, a sense of purpose, health and safety and well-being, employment, safety, and living in the community. People are at the center of planning a vision for their personally defined good life. which is done, as you know, through the person-centered planning process. Person-centered planning begins with who the person is and those things that are important to and for them. And then as a result, what do they want and what don't they want in their lives? And what goals might they have related to those things? The person-centered planning process requires that the person and their team work together to identify and or develop the resources, supports, and services that will support and or enable the person to live their good life. And they do this, so the team works together knowing that people's needs and wants are met through a variety of resources, such as their own strengths and assets, relationships with family and friends and acquaintances, through technology, the use of technology in the community as well, as eligibility specific services such as DDA, special education, and other related services. And they use all of these things in order to live their good life. Next slide. I'm sorry, not next slide. Next slide, please.
Good morning, everybody. What is self-direction? Self-direction, sometimes called consumer direction or participant direction, gives people the freedom to choose the services and supports they need to live independently in the community of their choosing. The core functions of self-direction are choice and control over how a person's services are provided, who is being paid to provide those services, and how much they are paid using the usual and customary rates established by the DDA. Next slide, please. The service delivery models are: when a person is enrolled in a DDA waiver, they are offered the choice to have their services provided under the traditional service delivery model, meaning services from DDA certified or licensed community providers, or choose to direct their own services within the self-direction service delivery model. Under the self-directed service delivery model, the person has the budget and employer authority. Next slide, please. Roles and responsibilities in self-direction. When a person chooses to self-direct their services, they have some key responsibilities. Amongst those are employer authority. The person has the responsibility to recruit, hire, train, and supervise your chosen staff or providers. We also have the budget authority. The CCS will work with the participants to develop and manage their budget, which includes how much they want to pay providers within the DDA reasonable and customary rates. Additionally, individuals who are self-directing their services collaborate with their CCS and chosen team to develop and implement their person-centered plan. It is important to remind and provide guidance and support regarding the participant role and responsibility when it comes to employer, budget authority, and person-centered plan development. Next slide, please.
Good morning. Let's talk about the roles and responsibilities of the family in self-direction. The participant's family, chosen friends, and other selected team members are responsible for providing the participant with valuable support towards the development of their vision for a good life. The family may assist the person in finding and utilizing natural community resources, but also to find employees and providers to address their needs. Their chosen family and selected friends may help the person to discover and explore new community and employment opportunities to ensure that the person have the options that they may choose from to ensure that they have a meaningful life, not a service-directed life. Next slide, please. While you as the coordinator of community services have many responsibilities, your key role is to assist and support the person in finding resources in their community to help the person live their good life. You are the lead supporter responsible for assisting the person in developing their PCP. And remember, this is one of the most important documents that you are responsible for. It should tell the person's story, detailing their needs and wants and what is ultimately important to and for that person. It is crucial that you spend quality time in developing the person-centered plan. You are also responsible for supporting the person in completing their self-directed budget sheet. Again, user-friendly guidance will be provided to you to assist you with this responsibility. Next slide, please. While it's not required, the person may choose to hire a support broker to coach and mentor the person in their role as the employer. They should not be functioning as the CCS. The support broker coaches and mentors the participant in their role as an employer with strategies to find, hire, and manage their staff, to advertise, interview, schedule, train, evaluate, and handle employee concerns, and to help to determine if staff are providing the services as intended. During the COVID-19 pandemic, support brokers may, in some cases, share additional roles. For example, they may function as a personal support staff. It is important to remember that the rates for these services are different and must be carefully documented when submitting timesheets. Soon, the participant will be able to search for and discover support brokers by going to the DDA website and search the list by region and county. This list has been updated with support brokers' contact information and will be made available on the DDA website by the end of January. The CCS can assist the participant in finding a support broker if this resource is needed. Next slide, please.
Hello. I want to talk a little bit about the roles and responsibilities and self-direction as it relates to fiscal management services. So as you are aware, the participant must choose between two current fiscal management service providers who are responsible for supporting many of their employer-related duties, such as withholding and filing federal, state, local, and unemployment taxes, purchasing workers' compensation and other necessary insurance coverage, collecting and processing timesheets, calculating and processing employee benefits such as sick or vacation time, and issuing payroll checks and tax documents. The FMS maintains communication with the DDA regarding the authorized PCP and approved SDS budget. Employee timesheets are submitted directly to the FMS, and the FMS provides the participants with monthly budget statements. The CCS should review these statements to determine whether the person is managing their budget appropriately. Next slide, please. To continue our conversation about roles and responsibilities of the fiscal management services, I want to talk a little bit about the January 2020 COLA. On December 17th, 2020, Governor Hogan announced that he was accelerating the July 2021 provider rate increase to January 1st, 2021. The FMS and DDA will be coordinating on releasing communication and guidance to participants, which will be sent the first week in February. This COLA will be effective back to January 1st, 2021. The budgets reflecting the accelerated July 21st COLA will be used until an annual or revised PCP is developed in LTSS, Maryland, which per the SDS memo on December 31st, 2020, will be occurring over the next 6 months. A dedicated FMS form will be used to allocate the January 2021 budget allocation. CCS should support the person when completing the form and requesting information. Next slide, please. Again, I want to continue this conversation about the roles and responsibilities and self-direction as it relates to FMS, the COLA, and future self-directed budgets. So again, per the DDA memo that was sent out on December 31st, 2020, we are working to ensure all participants using self-directed services have a holistic, quality, and detailed PCP in LTSS Maryland. This is ensuring that the detailed service authorization reflects the identified service needs per the PCP, which is important as it relates to establishing and updating the self-directed budget allocation, which will now be based on LTSS Maryland service rates. Next slide. Again, in regards to future self-directed budgets, as rates change due to rate studies, COLAs, or other means approved by the Maryland legislature, the DDA updates the service rate in LTSS Maryland. These new rates are used to calculate the person's allocated budget to direct their services as determined by their PCP. The required use of the LTSS Maryland PCP detailed service authorization for participants enrolled in either the self-directed service or traditional service delivery model ensures fair and equitable funding regardless of the model chosen. Next slide. Also noted in our recent guidance beginning January 1st, 2021 through January 30th, 2021, all self-directed plans will be reviewed and approved in LTSS Maryland. The regional offices will be monitoring and tracking this process to ensure completion by June 30th, 2021. Similar to the recent successful implementation of personal support supported living billing in LTSS, the regions will work closely with the CCS agencies and participants to ensure applicable timelines are met as outlined above. Next slide, please. The review and PCP revisions will ensure current services and fair and equitable funding allocation based on assessed need. When the new budget allocation is established by the PCP detailed service authorization, the person will need to create a new self-directed budget sheet. Participants will work with the CCS to update their self-directed budget sheet that will replace the January COLA budget sheet. The revised self-directed budget sheet will be submitted to the DDA for review with the PCP. The DDA will be issuing an updated self-directed budget sheet and reasonable and customary rates by the end of this month. Next slide. This slide is just a visual representation of the information I shared in previous slides, reflecting the January COLA and future budget allocation. The DDA is committed to reviewing and approving plans, including all self-directed plans during this 6-month time frame. The regional office will again share a PCP list with CCS agencies and recommendations on how to complete or distribute based on plan date and quality reviews. Remember that moving forward, the PCP detailed service authorization establishes the budget allocation, which is used to create the self-directed budget sheet that is reviewed and approved by the DDA. Again, the January COLA budget will be used until an annual or revised PCP is developed in LTSS Maryland. Once Once developed or revised, a new self-directed budget sheet is required based on the new detailed service authorization budget allocation. Next slide, please.
Roles and responsibilities in self-direction as it relates to employees. CCS should support the participant in choosing their employees carefully. Hired staff and chosen vendors are responsible for providing services as outlined in the PCP and SDS budget, maintaining any required training and certifications, and submitting information for criminal background checks as required. A participant enrolled in the self-directed services delivery model may use a legal guardian or relative who is not a spouse to provide services as noted in the DDA waivers. Next slide, please. The DDA is directly responsible for reviewing the submitted PCP and self-directed services budget sheet, which upon approval establishes the person's total allocated budget amount for their chosen authorized services. DDA submits both the approved PCP and SDS budget sheet to the FMS before services become effective. DDA maintains communication with the CCS, the participant, and the FMS to ensure program compliance. Next slide, please.
Each regional office has an advocacy specialist who can assist in advocating for individual rights, help to address violations, and guide individuals to appropriate resources. Everyone needs help sometimes. If the individual feels that their rights are not respected or they feel unsafe, it is very important that they let someone they trust know right away. It is important to communicate to the individuals that you support that who they talk to is entirely up to them, whether it's family, legal guardian, the coordinator, the support broker, or someone else on their team. They can also contact someone from the DDA's team for assistance. Next slide, please. Again, within the self-directed services delivery model, the individual has both employer authority and budget authority. With employer authority, they make all decisions in the recruitment, hiring, training, and supervision of staff chosen to deliver services. As the employer of record, the individual is also responsible for ensuring that timesheets are turned in to the FMS correctly and on time. You, the CCS, and the support broker can assist with this. Budget authority means that the participant can decide what they will pay their chosen staff to deliver services within the established reasonable and customary rates. It is the team's responsibility to submit the budget and manage to be sure that the participant stays within the amount allocated. Next slide, please. Today, we will review the overall plan and budget development process, which will result in the person-centered plan authorization and implementation. The goal here is to help the individual to better understand and move along their path towards self-directing services to help the person live their good life in their chosen community. Next slide, please.
Hello. So to kick off the conversation around the person-centered plan as it relates to self-directed services, we're going to start with the pre-planning process. Next slide. Whether an individual is receiving their services through DDA's traditional service model or self-directed service model, the DDA believes that people are in the driver's seat when it comes to their life, their PCP, and making choices. This value is a major tenet of the self-directed service model, which gives people budget and employer authority as it relates to their needed services. Next slide. Pre-planning is critical to developing a robust PCP, which serves as a blueprint for how the person would like to receive their supports and services in pursuit of the good life. This blueprint is the basis for the SDS budget. You may often hear that a budget is a reflection of values. Similarly, a person's PCP or blueprint is the framework for the person's budget, which ultimately is a reflection of their needs and values related to their chosen good life. In self-direction, collaboration during the pre-planning and beyond is so important given all the different players, including employees, vendors, support brokers, FMS, etc. All of these people are available to support the person in creating a blueprint for their good life. As people in the self-directed service model are creating their blueprint for the good life, it is vitally important to ensure there is trust among all the players to ensure the person is getting the information and support they need to make choices about their life. Pre-planning brings together people that are new to the person's life and those that have been around for a while. Families, friends, and long-term employees bring a history to the table that helps ensure a continuity of care as the person creates their blueprint from year to year. Next slide, please. What is important to me and what is important for me are two important questions that we all ask ourselves. When a person is developing their PCP, these questions often come up as people begin to think about, what do I want for my life? What are my aspirations? Where do I want to be in the next year? What do I need to be successful? What do I need to be healthy? And what do I need to be safe? Sometimes the answer to these questions comes easily. Oftentimes, it takes some thinking and planning. These questions are critically important for people and those close to them as they begin to ponder development of their PCP. The questions to these answers, or the answers to these questions often translate to support needs, goals, action plans, and begin to transform a person's PCP document into an active and living blueprint. Next slide, please. We all have a support system in our life, whether it's family, friends, or others that we trust and choose to let into our lives. People who choose to self-direct their DDA services choose their employees, vendors, and if they want, a support broker. All of these people and roles add value to the pre-planning process. Each person or role brings a perspective to the table about the person that allows them to make choices about their life, including identifying needs, developing goals, and choosing when and how they receive their supports. As mentioned earlier, trust, collaboration, and continuity of care are vital to the pre-planning process. It is important to encourage the person to include these people and voices that they trust and want to hear from in order to create a robust, informed blueprint for their good life. Of course, the person is the driver and can choose who they want at the table as they are developing their plan. Once the plan is complete, the person can share pertinent information to their employees or vendors to ensure their needs are met. Next slide, please. So, when and how do you start pre-planning? We've talked about the purpose of pre-planning and why it's important. Now let's discuss when and how you should start pre-planning. CCS are an important component of the process by initiating pre-planning no more than 90 days prior to the annual PCP. Remember, during the next 6 months, as we work to update self-directed PCPs and budgets utilizing the detailed service authorization, it will be critical to ensure pre-planning is happening prior to individuals' annual PCPs during that time, or prior to applicable quarterly monitoring events that will occur between now and June 30th, 2021, to ensure all SDS PCPs and budgets are updated by July 1st, 2021, per the DDA self-directed service memo issued on 12/31/20. To initiate the pre-planning process, the CCS should be coordinating with the person to determine who they want to include in pre-planning and identifying a date and time to have a pre-planning meeting. At that meeting, the CCS should work with the person to facilitate a conversation regarding the previous PCP, maybe talking about what needs to continue, what's changed. Also engaging in a conversation about what is currently important to and for the person. What are their needs? What are their goals? And what are their outcomes? The DDA encourages use of the life course tools described by Marianne earlier in the presentation to aid in these conversations. Good pre-planning is the basis for drafting a robust PCP draft and budget that is reflective of the person's needs. Prior to the pre-planning meeting, prior to the pre-planning meeting ending, don't forget to schedule the annual PCP meeting. Next slide.
Good morning. The next step is actually the development of the PCP. Next slide, please. So the CCS, in collaboration with the participant and their team, will develop a PCP that reflects the participant's outcomes, their identified risk, rights, restrictions, and needs, as well as making sure that the individual's health and safety is met. It's important to understand that this is a road life map for the next year for the individual leading towards their good life. Next slide, please. The PCP should not reflect a service life, but a holistic life for the individual. The outcome description is going to be defining what the person wants to happen as a result of the supports that should cover the areas such as relationships, job, gating and holding status in their community. So the pre-planning helps to direct the individual towards their personal outcomes. And then the team also should not just look for services in DDA, but other contributing natural resources in the community and help the person to have an integrated community life and not a service life. Next slide, please. Service authorization section. So this is the section where services are entered, and these are the DDA funded services that are noted. They need to be considered on a month-to-month basis so that the individual gets the services that they need. The request should be in accordance with the DDA waiver. You should take into consideration other available resources, assess the unmet need, and then look at potential duplications of services from other things that are available in the community. And then the service and the scope and the limitations need to be looked at as well. The PCP should include a section that includes a section that has documents. The documents that are uploaded into that section will help to justify the needs that were assessed. Next slide, please. Please note that there are different processes and information included in the detailed service authorization section. Under the traditional service model, the detailed service authorization section, the providers complete that, and then LTSS sends a request to the provider, and the provider then sends back the approval. Participants that are self-directing their service can hire DDA providers, but they are not noted in the detailed service authorization section. Next slide, please. Under the self-directed service delivery model, individuals and vendors, including DDA providers, are hired by the participant that self-directs the services and are not included in the service authorization section. The service referrals are not required because the billing is completed via the FMS entities, not LTSS or not PCIS. If selected by the participant, a DDA licensed provider should complete the detailed service authorization tool, and it should be sent to the CCS so that the team can add the correct units into the DSA. The CCS and the participant consider the units from the DSA based on their assessed need and put that into the service authorization section. It should capture, the service authorization section should capture all of the required information, including the service, the frequency, the scope, the duration, with the exception of the provider. So the provider is left out of the detailed service authorization, but everything else is included in that area of the PCP. Next slide, please. The PCP and supporting documentation needs to demonstrate the assessed need for the service request, needs to include what is the risk, what other resources have been explored, how long will the service being requested, how will the service being requested meet the needs or mitigate the risk for the individual. The assessed need can be demonstrated with documents such as the participant's schedule, the risk and mitigation strategies in the health risk screening tool, the nursing care plan, and the behavior plan. And it also can be included in the focus areas of what's working and what's not working in the PCP. Next slide, please. To assist with determining the unmet needs, the participant should be supported in developing a holistic full schedule showing when natural supports are being utilized, when the education system is being utilized, when other services such as doors, REMS, community first choice may be utilized, and then also when the DDA services are being utilized. The schedule should include what happens during a typical week for the individual. It's important to consider the services needed during summer breaks and times when schools are not in session. It's also important to consider the individual's wants and needs. Some individuals cannot go out when the weather is bad in the winter because of their health conditions. So that needs to be considered as well whenever creating a PCP for an individual. Next slide, please. The DDA will provide specific training on completing the self-directed budget sheet. It must be submitted with the PCP. The participant, with the support of their CCS, creates the self-directed budget sheet based on the detailed service authorization requests. This is how they come up with their anticipated budget. The self-directed budget sheet must mirror the services in the detailed service authorization section and the units included there. It shall not exceed the anticipated budget. Participants can set the wages in the self-directed budget sheet based on the reasonable and customary standards. Please note that the self-directed budget sheet for the initial PCP and the annual PCP cannot contain allocations for individual and family-directed goods and services, except for the staff recruiting and advertising. Next slide, please. Some important things to remember when submitting your PCP. You must project out the effective date in your planning to allow time for the PCP approval and for the FMS to set up the account. If a participant is moving from traditional services to self-directed services, you must assure that the traditional services end on midnight the night before the self-directed services start. Next slide, please. And next slide, please. This is a list of resources and links to things on the DDA website. There are things on here like the staff broker agreement form, family as staff form, the regional PCP review checklist that is utilized, as well as other resources that would help you in developing your PCP. Next slide, please.
I will now share information regarding the approval process for the self-directed person-centered plans and budgets. Next slide, please. The PCP approval process includes participants or their legally authorized representatives approval and the CCS approval. Based on information shared during the person-centered planning process, the CCS is responsible for developing the PCP and the LTSS Maryland system and for sharing the finished product with the participant and or their legally authorized representatives for their review and approval. Next slide, please. The CCS's responsibilities as it relates to PCP approval are as follows. The CCS will review the draft PCP, which includes the proposed services, scope, and frequency with the participant and their legally authorized representatives if applicable. The CCS will also ensure that the services noted in the DSA section of the PCP adheres to our waiver requirements as noted in the current approved waivers and the guidelines for service authorization and provider billing documentation. The CCS will upload all documentation to substantiate and assess need to the documentation section of the PCP. For example, if an assistive technology need exceeds $1,000, the CCS will ensure that an assistive technology assessment is provided and uploaded into the documentation section of the PCP. The CCS will ensure that the HRST is completed and a clinical review is obtained for people that have a healthcare level of a 3 or higher. Once approved by the participant, the CCS facilitates the participant's agreement on the participant signature page and uploads it into the PCP signature section. Next slide, please. The CCS's responsibilities with regards to the self-directed budget sheet include the CCS will review the SDS budget sheet with the participant and their legally authorized representative, ensuring the following. The budget aligns with the services in the DSA and that the rates adhere to the DDA's reasonable and customary standards. The effective start and end dates on the budget sheet correspond to the effective date noted in the PCP. Legally mandated earned sick and safe leave benefits are noted in the budget sheet for Montgomery County residents. Support broker services are accurately reflected with the appropriate hours and rates if applicable. Next slide, please. Individual and family-directed goods and services are purchased from savings identified and available in the participant's annual budget. The goods and services must fit within the participant's budget without compromising the participant's health and safety. Except for $500 per year for costs associated with recruitment of staff, the DDA will not authorize additional funding for individual and family directed goods and services in the participant's annual budget. All vendors or providers are listed accurately and taxes are not accounted for within the budget sheet for services provided by a vendor. If approved by the participant or their legally authorized representative, the CCS will upload the budget sheet into the documentation section of the PCP. Next slide, please. CCS's responsibility with regard to the waiver service agreement form and the participant signature page are as follows. The waiver services agreement form is an agreement between the Maryland Department of Health, DDA, and participants within the self-directed service delivery model to receive specific DDA services and supports. Once the waiver services agreement form is signed, the CCS will upload it into the documentation section of the PCP. The CCS reviews the final PCP with the participant prior to submitting it to the DDA. Once approved by the participant, the CCS facilitates the participant's agreement on the participant signature page and uploads it into the PCP signature section. Next slide, please. CCS approval is also required for the PCP. The CCS will conduct a final review of the plan to ensure that it meets all DDA requirements. The CCS indicates their agreement to the PCP by completing the Coordinators of Community Services signature page and uploading it into the PCP signature section. Once finalized, the CCS then submits the PCP along with the SDS budget sheet, waiver agreement form, and all other necessary documentation via the LTSS Maryland system to the regional office for review and authorization. Annual plans must be submitted no later than 20 business days prior to the PCP annual plan date. An initial and revised plan should be submitted within 10 business days or less after the participants or their legally authorized representatives' approval. Next slide, please. Under the self-directed services delivery model, DDA licensed or certified providers can be utilized as vendors. If selected by the SDS participant, the DDA licensed or certified provider will receive applicable vendor forms from the person's FMS agency. The provider's completion of the FMS forms is their agreement to provide the services. It should be noted that this agreement is specifically between the employer of record, who is the participant, and their chosen vendor or provider. The FMS confirms that providers meet required qualifications and facilitates the completion of any required documentation. Next slide, please.
Authorization process of the self-directed person-centered plan and budgets. Next slide, please. Regional offices receive, review, request consults, request clarifications, and approve initial, annual, or revised PCPs through LTSS Maryland. The regional offices will review PCPs within 20 business days and will use the PCP checklist to ensure all the necessary components of the plan are completed accurately. Other essential documents and tools that will be used during the review process to authorize services and determine and assess need include the DDA Service Authorization Guide, the current Medicaid waivers, relevant policies, and the Detailed Service Authorization Tool. There may be others that are person-specific. Next slide, please. All services noted in the Detailed Service Authorization section of the PCP should directly relate to an assessed need, and the corresponding documentation should be uploaded by you into the PCP to substantiate the need. In its review, the regional office reviewers may request internal consultations or external clarification requests with you to support the PCP. Once the PCP meets the approval criteria, the authorization will be finalized in LTSS Maryland. An approval letter along with the approved PCP, self-direction budget sheet, and signed waiver services agreement form will be disseminated to you, the FMS, and the SDS participants. Next slide, please. Important considerations for authorization. The self-directed budget sheet must include the DDA services authorized in the PCP based on the assessed need. The assessed need must be described within the PCP. Any supporting documentation to substantiate a need should be uploaded into the PCP. Participants may determine staffing and pay rates based on the reasonable and customary rate standards. The self-directed budget sheet for all PCP plan types may not contain an allocation of funding for individual and family directed goods and services, except for staff recruitment and advertising. The self-directed budget sheet may only be submitted by the CCS along with the PCP to be reviewed and approved by the regional office. As the champion for and partner with the individual, you play a critical role in helping them reach their good life. Your efforts and due diligence in effectively working through the pre-planning and plan development will improve the timeliness, effectiveness, and likelihood that the PCP will be approved and authorized. The assessed need is critical, and Medicaid will not pay for services that do not relate to an assessed need. To assist SDS participants, the DDA has developed the reasonable and customary rate standards as a guide to identify what rates the DDA would approve as meeting the reasonable and customary requirement. This guide can be found on the DDA website under self-directed services forms. An updated guide is expected at the end of the month, as noted in the Deputy Secretary's webinar on January 22nd. Next slide, please. And here we have included a list of helpful resources for you. Next slide, please.
Thank you, Tina. This just wanted everybody to know, those for joining us today, if you need to get in touch with any of the regional directors that presented today, or any specific individual information that you have about self-direction or the plans or the budgets or things that you're working with, that we have the Director of Central, Nick, and his contact information, Kim Gashaido from the Eastern Shore, Onesta Duke from Southern, and Kathleen Marshall from the Western. Next slide, please. And the next slide shows, you heard from Ola, who talked a bit about different roles at the beginning. And here's his contact information. Ola is the self-directed lead at the Central Office. And we have Jana Hitch, who is the one at the Eastern Shore, and you'll see her email right there. And also Tia Henry, who is the Southern Region self-direction lead, and Tina Swink, who is the lead at the Western Region. So these are the informations that we have. You also heard from Linda Yell, who is one of the deputy directors at the Western Region. So please know that we are here and available to answer any questions that you have. And now I'm going to turn this over to Dr. Smalls for some questions.
Thank you, DDA team, for today's presentation. We have received quite a few questions, and we'll use this time to attempt to get through as many as possible during our remaining time. Any unanswered questions will be answered through an FAQ page, frequently asked questions page, which will be uploaded to the DDA website for your review. Okay. The first question I'm going to throw to Nick. Nick, when can CCS providers expect the communication from regional offices regarding the plan for reviewing and updating self-directed PCPs before 6/30/2021?
Yeah, thank you. That's a good question. So we obviously, as reviewed in this webinar, but then also you should have received it in our email. We have sent out an initial communication regarding this process on December 31st, 2020. And as I mentioned today, we are currently working on getting a tracking system set up, and will be then regionally communicating with the CCSs regarding those individuals and kind of the process that we'll be going over the next 6 months. CCSs can certainly start planning, given the fact that they know who they are supporting that is receiving self-directed services, and the PCPs that are coming up over the next 6 months, annual PCPs, as well as the monitoring visits that are coming up over the next 6 months. But the regions will be in close contact with the CCS agencies regarding that and the process of what that will look like over the next 6 months.
Thank you, Nick. So in reviewing the questions, we had quite a few in reference to the COLA. So Nick, I'm going to ask if you would spend a little time reviewing how to apply it, when it will apply, since we do have people who have not received last year's COLA. Can you explain the process?
Yeah, so I'm going to speak to kind of what we presented today in the presentation, and if there's additional questions about individual budgets or self-directed plans, I would encourage you to reach out to the regional office regarding those. But in regards to the COLA, as we mentioned earlier, Governor Hogan on the 17th of December, due to emergency orders, has accelerated the FY21 COLA to be applicable January 1st, 2021. The DDA is working with the FMS to get communication and guidance out to participants and to CCSs and a form to be able to apply that COLA to budgets, current budgets. Simultaneously, we are also going to be working on updating and renewing the PCPs and budgets over the next 6 months to reflect the detailed service authorization. And remember, the services in LTSS that are reflected in that detailed service authorization based on an individual's needs have the COLA already applied. So individuals are going to be able to get the January 21 COLA right away based on instructions that'll be coming out by the DDA, that the DDA is working on with the FMS. And then when they update their PCP based on the detailed service authorization, that COLA that is already applied in LTSS to those service authorizations will replace that budget that was done based on the FY21 COLA that the governor issued, that we're going to be working on sending guidance out on how to do that. So it's really kind of a simultaneous process that's going to be happening initially for that FY21 COLA, and then as we start updating PCPs and budgets over the next 6 months.
Thank you, Nick. I just wanted to add while Dr. Smalls and Rana keep reading the questions is if anyone, and we've shared this with folks, if anyone feels that they have not received last year's COLA, we want to know, we want them to contact our directors of advocacy, Natoya Mitchell, or they contact Ron Peely, who is reviewing those to see if they were applied or not applied, or where to get additional information. And so we just want to make sure people understand that there's some questions about the COLA that Nick is talking about, that the governor told us to start in January, and then the COLA from last year. If there's COLA that is missing from last year to this year, then we will be working with the your CCS and the team to discuss how we're going to apply and move forward those plans. So I think for today's conversation, we just want to make sure that everybody was aware of what we're trying to do to implement and have current PCPs and budgets within our system as Nick described. So go ahead, Dr. Smalls.
Okay, thank you, Patricia. Linda, this next question is for you. Is the DSAT, the Direct Service Authorization tool, required to be uploaded to the Documents tab of the PCP if there's a DDA licensed provider involved?
It is not required, but if you have that document, you would want to put it in the documentation section so that it helps to verify that the services put into the DSAT match what the provider is willing to provide.
Thank you, Linda. Tia, if the person served wants to switch the FMS, what is the process?
An official process is currently being drafted in conjunction with both current FMS agencies and the DDA. However, while awaiting the release of that guidance, the CCS should contact the SDS lead in their respective region, and the lead will assist them through the process. It should be noted that there should be open communication between the participant and both FMS agencies so that both agencies are prepared for that transition.
Thanks, Tia. Tina, this next question is for you. If someone is using a vendor for DayHab, how is that documented in the Direct Service Authorization section of the PCP? LTSS does not allow for DayHab to be added in the DSA for people in self-direction. If the recommendation is to select other, that's not an option for people in the community service waiver.
That's a good question, and that question comes up quite frequently. So I understand within the community support waiver, there is no drop down for the other, as there is in the community pathways waiver. We need to, so we have that service listed in the detailed service authorization. I would suggest that you reach out to your regional lead and try to find a drop down that would be most appropriate so that we can put that in there and identify what the service need is. It is important that we do that. And as you know, DayHab, because you cannot, the participant does not have employer authority of that service. That's why you're not able to pick that as an option within the self-directed delivery model. But it is important that it be included so that we know that that's a service that the person is choosing to receive.
Yeah, and this is Rhonda. If I could just add to this, we'll follow up with LTSS functionality because that should be a drop-down option, and we can provide additional information.
Thanks, Tina. Thanks, Rhonda. Tina, this next question is for you. If the PCP is late to be developed, the DSA will not capture the full budget amount since it only shows from the effective date to the annual plan date. How can we ensure we see the full budget amount for the annual plan date year?
It's another very good question, and just goes to show us how important it is that we really try to get the PCPs completed in a timely manner so that we are showing a full year of service to capture that full budget, because we don't like to go back and backdate things, and that makes everything hard for not only the participant but the FMS in moving forward. So what I would suggest is that you try to get the PCP completed as soon as possible so that we're able to get as much captured in that detailed service authorization as possible, and that you work with your self-directed lead, regional lead, if there are issues about how to calculate a full year, since LTSS will not allow you to do that based upon when you're created the plan.
Thanks, Tina. Jana, this next one's for you. Can you better explain when someone can utilize individual directed family goods and services? If a person would like to use it and the money is coming from savings from their overall budget amount, not a new line in the DSA, are they able to utilize the funding? or can they only use it after the PCP is approved?
There is a up to $500 that is available for individual and family directed services specific for staff recruitment that can be put in an annual plan. Otherwise, funding would have to come from savings within the participant's budget that is identified during their plan year.
Thanks, Jana. Thanks, Jana. Nick, this next question is for you. Can DDA confirm that a new self-directed budget sheet will be shared with the CCSs by the end of the month? If so, should we wait to submit progress PCPs until this is received?
Yeah, so yeah, we are updating that budget sheet, and it will be available. I believe it was by the end of this month, so we're already on the 27th of this month, so should be soon. There's only 3 days left.
So why don't we tag team, and while Dr. Swanson's reading, Rhonda, can you read the next one?
Yes, thank you, Patricia. This one is for Tina. Tina, can you share how cost for obtaining a clinical review for a health risk screening tool or a behavior plan is needed and obtained?
How the cost is obtained?
So if someone needs an HRST clinical review or behavior plan, how should they go about seeking those services?
Okay, that's a good question. So the CCS should help you find DDA approved providers for those services. There is a list of nurses that have completed the DDA RN nurse case management training who have indicated that they are willing to provide nursing support services to self-directed participants. So I would suggest that the CCS review that list to find a nurse that might be in your area that could provide that clinical review. Because that nurse is a vendor, then they have the, you would work with them to establish the rate for that review. And as long as it's within the reasonable and customary range, then DDA would be able to provide the payment for that to that vendor. And the same would be true to behavioral support services. Once again, you would need to find a provider that is local to you within your region that would be willing to provide those services to you in your self-directed plan.
Thanks, Tina. Next question is for you as well. Are CCSs still completing budget and plan modifications, or do they now complete a revised PCP when there are changes throughout the year?
Tina, if you're talking, you're in mute.
Oh, I'm sorry. I didn't realize that was addressed to me. How we're handling that, it is certainly if the services are changing and the service cannot be provided within the current budget allocation, a person will need to complete a revised PCP to have that service need met. While we're working through this transition, we understand that there may be times where a service might need to happen relatively quickly, such as a clinical review of an HRST so that a PCP can be submitted. And if there are savings within that budget and that plan, that adjustment can be made within the existing plan and budget, then you can work with your regional office lead to complete that through a plan and budget modification, just so that we can get that done quickly while we're in this transition process with all these changes in self-directed services and using the detailed service authorization.
The next question is for Tia. Tia, can you provide some information and guidance on how a CCS should list the FMS and paid support brokers under the service authorization section of PCP?
Yes, so for the support brokerage is a waivered service. So it should be chosen in the DSA. So you should actually choose support broker as the service that the person's receiving. And then you would add that information in that service. Because FMS is not a waiver services and there's not anything about the FMS in the drop down. If the person happens to have a support broker, you can include that information, the information about the FMS in that section as well. Some people have been submitting plans in using the other option and entering the FMS that way.
Thank you. Thank you, Tia. Tina, this next question is for you. If I'm understanding correctly, can we only use individual and family-directed goods and services for staffing and advertising? I have a client who has a pretty thoroughly documented need for a customized wheelchair, but she can't afford the wheelchair herself.
So the answer to that question is individual directed family goods and services for the staff recruitment can be included in an initial plan and an annual plan. That's the only time that DDA can approve individual directed goods and services for one of those two plans. If a person has savings within their budget, they can come back to DDA with a revised plan and ask for individual directed goods and services as indicated for some of the items in the waiver service description once they have savings within their budget, but they cannot submit that request in an annual or an initial PCP.
Thank you. There's the next question, Dr. Smalls, is for you. Are CCSs still completing budget and plan modification processes, like the Modified Service Funding Plan process, or do they now complete a revised person-centered plan when there are changes throughout the year?
So I know we previously answered this, but one of the main focuses for us moving forward is that anytime a plan to the person, change to the person's budget needs to occur, it would happen through the revised PCP process, not through the previously implemented budget mod process.
So there was a memo that was sent out to everyone, letting everybody know that we're no longer using a modified. Any changes in the person-centered planning, we want to make sure that we will do a revised PCP. And so the CCSs, you'll be working with that to make sure that gets done. Nick, would you like to add anything to that?
Yeah, I just want to reiterate we've been very clear in the memo, in training, in the November 6th webinar, that we do not have a modified service funding plan process, and that needs to be done through a revised PCP.
Thank you, Nick.
So the next question, Nick, you can help us with this one too. It is suggesting that communication and clarification would be great about the necessary for plan and budget mod processes and when it can be used versus the revising PCP. So we seem to still have some questions about revising a PCP versus a mod process. Can you just clarify that again for us?
Sure. So, when we think about the life of a plan, we think about annually, somebody has an annual plan date that comes up, and everyone sits down at the annual planning meeting. There's pre-planning that's gone on. They develop the plan, they submit it, the plan gets approved. During the year, and at that annual planning meeting, we really encourage people to make sure that that the needs are captured and fully captured in the PCP so that the person's needs can be met throughout that planning year. There are times that things pop up in between annual plan dates and needs change. When that occurs, the team needs to come back together and they need to have a conversation about those needs. Sometimes those needs require that a PCP revision be completed. And the CCS facilitates that PCP revision in LTSS and submits it to the regional office with any applicable documentation to review. The regional office then reviews that PCP revision and approves it, may send it back for clarification based on whether or not there's a justified need that may be denied. But that's a conversation that's going to happen with the CCS agency. Once that is approved, depending on where the service is currently being funded, either through LTSS or through PCIS2, that will be worked through the fiscal department to make sure that it gets added into PCIS2 if it's a service in there. It will go to the FMS if it's a service that is based off of a self-directed service, or if it's in LTSS. Once it's approved, there should be approval and access to bill for that service in LTSS.
Thank you, Nick.
Yep, you're welcome. Yep.
Thanks so much, Nick. Just in addition, just to remind folks that the PCP needs to remain a holistic process. So as Nick really emphasized, when there is a change that really needs to be reflected in their overall plan year, that change would occur through the revised PCP process. Our next question is for Tina. As CCSs either create a new, revised, or annual self-directed PCP, until June 2021, the total amount in the DSA should match the total self-directed budget. Is this not a process that's going to be ongoing after 2021?
Okay, so I'm trying to understand the whole question. If somebody is revising a PCP now, depending on when your annual plan date is, the detailed service authorization funding amount will only be for that time period. As we're coming through this process and aligning everybody's PCP to the detailed service authorization, we should have a full plan year in there for people with annual dates between now and July 1st, so that it is showing a full year's allocation of their budget. I'm not I'm hoping that answered the question. I'm just trying to put it into context. So if there's more that I need to add to that, I'd be happy to do that. I'm trying to understand it.
Tina, you answered that well. Thank you so much. The whole point was that if it's a shorter year when the budget actually is revised, how is that reflected in the overall budget? Thank you for that.
So the next question is for Ola. Ola, is a rep payee considered a legally responsible person in relationship to the family of staff or a service such as personal supports? Basically, they want to know, can a rep payee be paid as staff under personal supports?
Yes.
Thank you. We're just reviewing the questions and looking for some additional ones that we haven't addressed.
There's a transportation question in there. Can you address that one?
Sure. There's a question in here related to the transportation. The standalone transportation cap in the DSA is set at $7,500. And as you know, transportation is a standalone service that people can access to utilize things such as Ubers and Lyft, to get travel training, mileage reimbursements and such. When they are traveling within their own community, and that would be independently. They would not be with their staff. With the transition to the new rates and services, including personal supports, some of the things that we will be doing is looking at the transportation request and the use of that, as there is transportation as part of a component of several of our services. That would include our community development services, our employment services, and now, effective January 1st, our personal support services. Therefore, we would be looking at the request for transportation to be considered as independent community transportation versus supports with personal supports or other services that has that as a component.
Thanks, Rhonda. I'll take this next question. It's in reference to the SDS budget sheet. So after the SDS budget sheet has been approved, can you share a sample with the CCS agencies to review prior to posting to ensure that it's functional and effective? We know that the self-directed budget sheet had a calculation error in it, and want to ensure that again, the tool is user-friendly, and that participants and CCSs know and providers understand for every line how they should be entering information and amounts. So we will ensure that CS agency leads have an opportunity to see and review it, but it will be thoroughly tested prior to us posting it and sharing with participants and stakeholders, CCSs and providers.
Hey, Donna, can you please go to the slide that has the COLA information for, if you can look at slide 17.
17.
There's a lot of questions. Yes, there's a lot of questions specifically on clarification of the FY21, FY22. So I just wanted to make sure people understood this one slide, Nick, if you wanted to emphasize. And I know we've talked a lot about this, but people are getting confused about the FY21 or FY22 and the January information that the governor shares. So I know we said this, but I think say it again, it just helps people to be grounded. And if we need to repeat it over and over, we'll continue to do that, because we want to make sure the CCSs, the families, and the participants in self-direction fully understand what we're saying. Go ahead, Nick.
Yep. So as we've talked about, there is the 4% COLA that the governor authorized to be for January 1st, 2021. We are going to be releasing guidance and information with the FMS on how to apply that. You can see in the green that for future budget allocations, and as we begin over the next 6 months to utilize the detailed service authorization in the PCP and LTSS Maryland, we will be needing to update the budgets based on that detailed service authorization. The services based on need within that detailed service authorization will reflect the 4% increase for the budget allocation. And a new budget will be created, and it will replace that one, the one that we are sending out guidance on how to immediately add the 4% COLA to your total budget at effective January 1st. So you're going to be able to immediately add people are going to be able to immediately add the 4% COLA to their budget. That's going to happen immediately. We're going to be sending out guidance on how to do that. Then As we work on updating all of the PCPs and the budgets to reflect the detailed service authorization, the services that are chosen in that process through the detailed service authorization will include the rate for those services includes the 4%. And then that will replace this immediate 4% COLA budget allocation that you guys are going to be working on as soon as we release the guidance very shortly.
Great, thank you, Nick, for that clarification. Please know that this handout is in your docket to your right of your screen or the left, wherever you're carrying this, but there's an option where it has handouts. Some of you wanted to know if this is going to be shared. You have the handout, and then we will be posting it on the DDA website. We have about 5 more minutes, so I'm going to turn it back over to you, Rhonda and Dr. Smalls.
Shauna, can you provide guidance on when it's appropriate to document one-to-one funding in the direct service authorization? All self-directed services are provided on a one-to-one basis, just given the model of service.
Correct. It would be appropriate if one-to-one was needed in a day program situation. You could provide that documentation.
Ola, the next question is for you. Can you share when the participant agreement will be updated?
After the meeting with the participant and their team, and prior to submission submission of the person-centered plan.
Thank you. Tina, can you share information about when the self-directed budget modification form would be used?
The self-directed budget modification form would be used if somebody is attempting to change funding within their current approved budget from 2 line items that are approved from one line item to a next. For example, if somebody had underutilized their CDS funding, but overutilized their personal supports funding, because those are both approved services within their plan, they could transfer money from one line item to the next to cover the difference.
Thank you. Kia, could you share some information about travel reimbursement? The question specifically is, can the participant receive reimbursement for travel?
The reimbursement for travel is for the employees. If in the process of them doing their job, they are providing the transportation for the participant, then that would be for the employee.
Thank you.
Dr. Smalls, if you're talking, you're on mute.
Sorry, I sure was. Thank you all for joining today's presentation. As CCS providers and vendors and participants, you all have key roles in the process of supporting people who have chosen to self-direct. The DDA values your feedback, so as before mentioned, we will be responding to all of the questions and uploading as a frequently asked questions page to the DDA website. We share in the challenging work of supporting people with disabilities and are motivated to provide you with all the resources, tools, and continued training to help you support people in successfully self-directing their services. In closing, continue to be safe, be kind to each other and yourselves, and enjoy the remaining of your day. Thanks.